In this module, we are going to learn the first aid for snake bite, animal bite and insect sting. First, we will see the first aid for snake bite. If a person is bitten by a poisonous snake, the poison enters in the victim's body. This poison mixes with blood and spreads quickly in the body. Let us see a small video about the first aid to be given for a person who is bitten by a snake.
One evening he was walking in the park and suddenly he was bit by something. He screamed and looked around and he realized it was a snake. He shouted for help. It is a good idea to notice the color, body scales, head or any special characteristics of the snake because it will help the doctor to identify the venom. If you missed it, it is okay. Do not waste your time looking for the snake or trying to kill it. The most important thing is the victim should remain calm, relaxed and fearless. Otherwise, it will increase the blood flow and the heart rate, resulting in the rapid spread of venom. Do you know only 20% of the snakes are venomous, and there are 50% chances that venomous snakes will deliver a dry bite. Even if a snake has delivered a venomous bite, by following the correct treatment and measures, you can easily save yourself from any injury. One of John's friends came to help him and called the ambulance. He moved John to a safe place. The affected part of the victim should be kept immobile as much as possible while moving the victim, and it should be kept below the level of the victim's heart. The helper makes the victim sit on the floor with the affected legs stretched. Remove any tight-fitting clothes, any rings, wristwatch, etc. from the affected body part or on the wound itself. Otherwise, it might cause swelling. It is important not to cut the wound as it will increase the chances of infection. Do not suck the venom because it will only remove a negligible amount of venom and might also poison the helper. Do not eat or drink anything, particularly caffeine or alcohol, as it increases the heart rate and blood flow. Arrange a long bandage or clean cloth. Wrap up the wound loose enough to insert a finger and wrap it up till the top. Do not use a tourniquet as it could potentially restrict the blood flow to the affected area. Do not use ice on the wound because it might increase the damage. Immobilize the body part with a wooden piece or a stick and tie it with a bandage or a cloth before you transfer the victim to the hospital. The doctor can then detect the venom and administer the suitable antivenom to the patient. Presence of mind and immediate treatment can save the life of the patient after a snake bite.
First aid for animal bites.
First aid for animal bite. Animals attack when they are provoked or in danger. Even the minor animal bites and scratches may lead to complication. To treat a minor bite, first wash your wound thoroughly with soap and flowing water. Wash the hands also well after cleaning the wound to avoid the infection. Then cover the wound with antibiotic ointment and clean bandage. Consult doctor for further treatment as you may need a tetanus shot. It is must to take doctor's suggestion in case of punctured or broken skin. In case of major bite after giving the first aid, take the necessary medical help.
The bites of stray animals like dogs, cats and monkeys can cause a disease called rabies. How does rabies affect us? When these animals bite someone, they release saliva containing germs from their mouth. The saliva enters the victim's body through the wound and affects the central nervous system, causing rabies. Third one is first aid for insect bite. We may get stung by insects such as bee or wasp. In such cases, the sting must be removed first and then some ice cubes could be placed in the bitten area. An antiseptic cream can also be applied on the bitten area. For bee stings, a paste of baking soda or toothpaste can be applied and for wasp, lemon juice or vinegar can be applied. Dear students, so hope it was clear. So be careful, be aware and be safe. Have a nice day. Thank you.